Welcome to Healthy Talk with BCH, empowering your wellness one conversation at a time. I'm your host, Rachel Mann, and February is Heart Month, so today we're diving into the heart of cardiac health with a special focus on cardiac rehabilitation. We're joined today by Kendle Demery, RN BSN, in the Cardiac Rehab Department here at Boone County Hospital. Welcome to the show, Kendle.
Thank you, Rachel.
So let's jump right in. Can you explain to our listeners what cardiac rehab is and who it's for?
Cardiac rehab is an exercise and education-based program that is supervised by our medical staff here in the hospital. That includes our supervising physician, the nurses that work down in cardiac rehab, and also our exercise specialist. Anyone who's had a heart attack, heart failure, a procedure called an angioplasty, or heart surgery can be referred to cardiac rehab. And so those are the general people that we serve.
What's the first step for someone who's entering cardiac rehab?
The first thing for someone that's entering cardiac rehab is that we have to have that referral in place.
Okay.
So that's usually ordered by the patient's cardiologist or their cardiac surgeon after they've had said heart attack, heart failure episode, or procedure within the hospital. So we have to get that on file. And then after we have that, we're able to bring our patients to the hospital where we do an initial interview and get them started in our program.
What are the main components of a typical cardiac rehab program?
For cardiac rehab, it largely consists of three main things: exercise, education, and support. Our cardiac rehab classes meet 3 days a week, Monday, Wednesday, and Friday, anywhere from 1 to 3 months. We can take patients from 12 sessions all the way up to 36 sessions with us. That amount of time is really just very patient dependent. It depends
Whatever they need.
Yeah, it depends on their diagnosis and how well they're doing within the program. We tailor it and individualize it to each patient. So another component of cardiac rehab is the exercise, where we monitor them very carefully. We hook them up to a 5-lead monitor where we can see what their heart rate and rhythm is doing while they're exercising. We check their blood pressure. We ask them how hard they're working on our exertion scale. And we just monitor all those things to make sure they're exercising at a level that's safe for their heart and their body. Then we also have an education component where we sit down in a classroom and we give lectures on certain heart healthy topics and ways to take care of their body and their heart and decrease their likelihood of another cardiac event. And those can be really tailored to each person as well, because maybe somebody came in that had a bypass and we'll talk to them about that, but the next patient came in because they had a heart attack.
Okay.
So it's just different things. Another component is support. Our cardiac rehab staff will be your biggest cheerleader, but in the end, it's up to our patients to implement change and do what they can for their own well-being. We want our patients to be equipped with all the tools necessary to reduce their risk of more problems with their heart. We're here to answer questions and be a resource for our patients. And most of the time, our patients find a sense of camaraderie with one another during their time in the program, because there are obviously other people in the class.
Sure.
Our patients often have similar experiences related to their heart disease, and they really bond over that common thread.
Because sometimes there's things in your life that you're like, nobody can relate with me on this. And at cardiac rehab, you're literally in a room full of people who can relate with you.
Yes, they all can share stories with each other, and it's amazing how they make those connections and say, oh, I experienced that symptom too, or this was also hard for me, or you had to wear this piece of equipment. I'm also having to wear this piece of equipment for a long term. And then they'll talk about their appointments and their doctors that they see. And they actually will exchange doctor information and say, I like this cardiologist. Do you like this cardiologist? Well, I like mine better, so I think I'll go to that one.
So nutrition probably plays a big role in this. Can you talk about the importance of diet in cardiac rehab?
Yes. So nutrition is a big one. And that's actually one of the classes that we have and offer to our patients. Our dietitian comes and teaches 3 different nutrition classes with our patients. We highly encourage them to follow a heart healthy diet. And really the big takeaways for that are to try to decrease your sodium intake by reading food labels and not adding salt to food. You want to try to limit those non-saturated fats and incorporate healthy fats, and eating whole grains, fruits and vegetables, whether they be fresh or frozen. Choosing lean protein, low non-fat dairy, and minimally processed foods.
Is mental health another critical aspect?
Very much so. These patients that have had these heart events have gone through something incredibly life-changing. We see high rates of depression, anxiety, and stress in these patients after these cardiac events. So we also have a class on that, stress and management and healthy ways to cope, because we want people to, again, avoid those vices like nicotine and drugs drugs or alcohol, which can all be coping mechanisms. So we talk about ways to cope with that in a healthy way. Of course, it's challenging for everyone, but especially when they didn't see it coming, it can really hit them hard. So I always just say, in combination with exercise and support at home, in cardiac rehab itself, with anyone else in their healthcare team, and then sometimes medications are helpful as well. And we screen all of our patients for depression when they come. We do a PHQ-9 and have them fill it out on admission and on discharge. And we have a number where we'll send that off to someone's primary care provider just so that they're aware, and they may already be aware of that patient's level of mental health, but
sure,
we keep a good eye on it as well.
With technology evolving, how has it impacted cardiac rehab?
We try to stay on top of that as much as we can. Our cardiac rehab program here at the Boone County Hospital is accredited by a body called the American Association of Cardiovascular and Pulmonary Rehabilitation. And through that accreditation, we have access to a lot of the most up and coming research and technology. So anything that they are telling us to do, we do try to implement and make sure that we're giving the best program for our community that we possibly can. The big thing is that we have wireless EKG monitors that communicate with our charting system. I can literally watch people exercise on the treadmill in New Step and see what their heart is doing in real time.
Let's talk about some challenges that some of your cardiac patients face. How can you help them overcome their challenges?
I think the main challenge for our patients are like their physical disabilities or abilities and mental blocks, really. Things like chronic pain and physical disabilities really make it difficult for some of our patients to use certain pieces of equipment. And when that happens, we just find another way to exercise their heart muscle. If they walk with a walker or a cane, usually we end up forgoing the treadmill and just have them walk laps within our unit as many times around as they can in a certain amount of time.
I'm sure for some people that just walking is putting enough on their heart.
It is. And we see that when we look at their heart rhythm and their heart rate and we ask them how hard they're working, and when we measure their blood pressure and see that it's responding appropriately to quote unquote exercise of walking around the unit. So that's good. And then we also have these machines called New Steps that some people may know what those are and some people may not, but they're just like a seated elliptical machine where you move your legs while you're sitting in a chair and you can move your arms simultaneously. And that alone helps with cardiovascular fitness and working your heart. But yeah, we really try to tailor it to each specific person. And then, like I said, the mental aspect comes into play too for some patients, especially if they've A, never exercised before, or B, haven't done it in a really long time. They have a preconceived notion about their abilities or lack thereof and their limits, and it makes it a little bit difficult for them to try new things sometimes. We try to promote a culture of safety at cardiac rehab, and we want our patients to trust us and our recommendations. So we're not going to push them to do anything that's really uncomfortable, but we want them to work a certain level to help their heart.
Well, sure. I think part of anybody's work is you like focusing on the positives. So do you have any success stories you can share from your experience?
There are some general successes that seem to happen with our patients. I had a patient the other day who I graduated from one of our programs, and he said, I learned a lot more than I thought I would. I feel better than I have in years. I don't want to go backwards. I'm going to try to keep doing XYZ when I'm out of the program. So that's always really good that people say that. And we want them to have a plan for after they're done. Like, what are you going to do with your diet? What are you going to do with exercise? And there are some resources within the community, thankfully, but we also have a maintenance program here at the hospital that's like a gym membership kind of. People can do self-pay after they've completed the program. And even people out in the community that have heart disease that don't qualify to come in for what we call our phase 2, one that needs that referral. They can come in, they can work out, we check their heart rate, we check their blood pressure, they can work out on the machines at whatever level they like, and we keep an eye on them, and we're a resource. So if they have questions, we can answer them. If they want to come and keep working out with us, they sure can.
So for anyone looking to improve or maintain their heart health and avoiding the need for cardiac rehab, what lifestyle changes would you recommend?
The big things are exercising regularly. We recommend 30 minutes to 1 hour of like continuous heart pumping exercise 5 days a week if they're able. Eating that heart healthy diet that we talked about, decreasing sodium, fat, and sugar are the big parts. If setting a goal weight is something that a patient has in mind, trying to talk about how to do that safely with their primary care provider is important, or with us if they need to. Stop smoking, decrease your drinking, don't do drugs. Getting quality sleep is really important. So if anyone has obstructive sleep apnea or something where they have to wear a BiPAP or a CPAP machine at night, do that. Do those things that are prescribed to you, and taking all of their medications that are prescribed too, because they all have a purpose. And if you ever have a question about it, ask your pharmacist or ask your doctor, because they're the best resources. And we have a class on your medications that is taught by our pharmacist here at the hospital. So
perfect.
She can tell you all about why you take the things you do. Also, I should say finding a way to reduce stress in a healthy way is really important, because chronic stress on the heart is really damaging.
Obviously, there are so many benefits for cardiac rehab. Why would someone hesitate to join the cardiac rehab program?
I think I run into this a lot, especially with our aging patient population and just the old farmer mentality of the people in Iowa that are coming in. Everyone's hesitant to do something new and different. I think that most people are worried that we're going to make them run on a treadmill or do a stress test every time they come in. And that's
Today you're going to run 5 miles.
That's not the case at all. We don't make people do that. We want our patients to be successful in their recovery, and that means easing into exercise and working at a level that they can maintain, but also work their heart muscle effectively. We're not as scary as some people might think that we are. It can be really overwhelming for a patient to feel like they need to completely overhaul their whole life to be heart healthy, because changing how you eat, adding exercising, and trying to quit smoking on top of it, it's really hard.
You said try to keep your stress low. So I'm sure, though, trying to make these good changes can be stressful for someone too.
Yes, absolutely. So that's why we always try to stress why we don't.
No pun intended.
No pun intended. We just try to tell our patients, make one small change at a time. It's better than nothing at all. We want our patients to set big goals and to aim for those big goals, but set those smaller ones so that you can build up to those to achieve those big things.
You don't want to set astronomical goals that are going to feel defeating when you don't reach them.
Exactly. And we do that with all of our patients. When they come in for that initial interview, we sit down and we go through their individualized treatment plan, and we set personalized goals. Like, I want to be able to walk around the block with my dog. I want to quit smoking. I want to run a marathon, which I haven't had yet, but someday someone's going to want to run a marathon. I want to eat healthier. Any of those, like, nothing is too small. No goal is too small. And I want people to feel successful in whatever they're trying to achieve.
That's fantastic advice. Looking ahead, what do you see for the future of cardiac rehab?
As far as cardiac rehab goes, I don't think that a lot of the major parts are going to change, but I know right now there's a big focus on ways to allow easier access to cardiac rehab programs for patients and better insurance coverage for it as well. At this point, we've moved into being able to have our programs directly supervised by someone other than an MD or a DO, which is a big step because we're largely governed by Medicare guidelines. The entire cardiac rehab community at large is pushing to have everybody be able to order cardiac rehab, like our NPs and our PAs and all of these important people in our healthcare system. And I think that that'll help increase the number of people that we're able to help in our community.
Before we wrap up, can you share what inspired you to specialize in cardiac rehab, and what is the most rewarding part of your work?
I spent the first 11 years of my nursing career as an ICU nurse. I saw patients at their sickest, and if they made it out of the ICU, I wasn't able to follow them or see how they recovered or if they recovered. After COVID happened, I was really ready to move away from the bedside for even a short period of time, just to try something different. I wanted to develop a relationship with my patients and be able to see how they progressed over time. And I'd done some PRN as needed work at pulmonary rehabilitation clinic in Iowa City, and I found that it was really rewarding in a different way than working in the ICU, to be working with those patients. Cardiac rehab really allows me to work closely with patients to improve their overall health, and I enjoy being able to see them multiple times a week and watch their progress as they make their way through the program. It's most rewarding when everything seems to click for a patient and they're able to meet the goals that they set for themselves, or at least well on their way to meeting them.
We've talked about how fortunate Boone is to have the resources that we do in such a small town. Would you say cardiac rehab is a common thing to have in rural hospitals, or are we lucky to have it here in Boone?
We're very lucky to have it here in Boone. It's not something that we have everywhere within the state of Iowa. It's not something that we have in every rural community in Iowa. We get patients from a lot of the surrounding communities that come to Boone because we can get them in quickly, because we don't have a huge wait list. We do have a little bit of a wait with our pulmonary program, but with the cardiac one, by and large, we have have a lot more slots and we can get them in more quickly than they can in some of the other bigger communities. And we offer a program that's at the same level as those, especially since we're an accredited program through the American Association of Cardiovascular and Pulmonary Rehabilitation. And that's a big deal. That's pretty cool for Boone.
You said people come to cardiac 3 times a week sometimes?
We like them to come Monday, Wednesday, Friday, and it can be anywhere from 1 hour to 2 hours.
When
depending.
You don't have to drive an hour to get somewhere, I've just got to go 5 minutes, or maybe some people live close enough they could walk.
Yep, exactly. It's very, very good to have.
Well, thank you so much, Kendle, for sharing your expertise and for all the work you do in cardiac rehab.
Thank you, Rachel.
Thank you to our listeners for tuning into another episode of Healthy Talk. If you're concerned about your heart health or want more information, call one of our family practice physicians or the BCH Cardiopulmonary Rehab Department at 515-432-8120. Remember, taking care of your heart is one of the most important things you can do for your health, so don't hesitate to seek help if you need it. Until next time, stay informed, stay healthy, and keep the conversation going with Healthy Talk.